Throughout the COVID-19 pandemic, hospitals and health systems have been forging new partnerships with stakeholders to ensure ongoing care for their patients, healthcare workers, and communities. To highlight these efforts, AHA has launched a new series of resources, Joining Hands for Greater Impact. Over the next few months, we'll be sharing the stories from across the country of how hospital partnerships have addressed urgent community needs throughout the pandemic. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. Today's podcast features how EvergreenHealth, Overlake Medical Center, and Microsoft partnered to get their community vaccinated. This podcast was funded in part by a cooperative agreement with the Centers for Disease Control and Prevention. The contents of this resource do not necessarily represent the policy of CDC or HHS and should not be considered an endorsement by the federal government. AHA's Julia Resnick, Senior Program Manager for Strategic Initiatives, is moderating today's podcast. She's joined by Gordon Oakes, Director of Clinical Support Services at Overlake Medical Center, and Jeff Friedman, Vice President of Operations at EvergreenHealth, to discuss their partnership to get their community vaccinated. Julia, over to you.
So, Gordon, Jeff, I'm so glad to be talking with you both today. Let's start with some background on your hospitals and the community you serve. So, Gordon, why don't we start with you?
Perfect. Overlake Medical Center and Clinics is a 349-bed nonprofit regional medical center in Bellevue, Washington. It has an ambulatory network, and we offer a full range of advanced medical services for the Puget Sound region. We've got a volunteer board of trustees. We have about 3,200 people, some 1,300 active and courtesy providers on our medical staff, about 200 providers who are employed by the organization. We were the first level 3 trauma center on the east side. And like our partners at Evergreen, known for providing award-winning, compassionate, and patient-centered care, commitment to maintaining the highest standards in medical care, and that's a major reason why patients and family choose Overlake. It's the reason why we received many awards and recognitions, both regionally and nationally. And we're very proud to be standing alongside and talking to you with our partners at Evergreen.
Great. Jeff, can you tell us about Evergreen?
Certainly, EvergreenHealth is a two-hospital public district healthcare system. Our primary facility is located in Kirkland, Washington, in East King County, which is the county that Seattle is part of. Our districts serve over 1 million residents. In addition to our hospitals, we also include a large employed medical group of over 300 providers, a very large home health and hospice care service, which obviously played a big role in terms of caring for patients over the last year. Like Overlake, Evergreen is a very well-recognized hospital, a top 1% by health grades, and has been serving our community since 1972.
That is great. So, how have your hospitals partnered in the past, and how did that relationship change during COVID-19?
Well, Evergreen Health and Overlake actually have a number of formal partnerships that we work on together. We're part of a clinically integrated network called Eastside Health Network, as well as a couple of clinical joint ventures for the cardiothoracic and neuroscience service lines. And it was actually through the clinically integrated network that Microsoft, we provide healthcare services to their employees through this CIN. They actually approached the CIN and asked us, how can we partner on a site to provide vaccinations on the east side? So we have a history of working together, and it was both of us saying, yes, how quickly can we do this?
That history goes back years and years. I function as a director of pharmacy for Overlake, and we've always been colleagues organizationally. We're only 7 miles apart. If we needed something and their pharmacy had it, it was available for use. And likewise, it's a great network that we've had even before any formal EHN. I think the COVID-19 as an event really served to highlight the vision that we have for caring for our communities and the commitment. Our ability to respond to a local, regional, national, and this global event really is built on the structures and processes that Overlake and Evergreen have established within our organizations and between our organizations to collaborate and coordinate services for our community.
That's great. And speaking of your community, I know that the past year has been really challenging for everyone, but are there any unique challenges that your community has faced, and what have your hospitals done to respond?
Boy, I don't know, Jeff. I'd say it'd be easier to name the challenges we haven't faced. It's been an incredible year. Jeff, you guys were at the tip of the sword, tip of the spear, so to speak, in the outbreak.
Yeah, EvergreenHealth was actually, where the first community acquired cases arrived at in the country at our hospital. And then Overlake very quickly thereafter started seeing cases. And then some of the first mortality in the country happened locally for us. So our challenges are probably the same that many organizations across the country experienced. We just had the opportunity and the challenge of getting them first. And so there was no playbook, there was no experience, and in some ways that did help us. We got a tremendous outpouring of support from the community. Providers and community groups pulled together to help us provide services. But we went through the same litany of challenges that hospitals across the country, whether it was PPE access and availability, concerns about staff becoming positive, getting sick, or passing away, testing availability of trying to detect the virus through the laboratory, clinical research. We were in on the ground floor of conducting clinical research on patients and remdesivir as a treatment option, handling the media, working with the public and public health authorities and responding. And then in this latest stage is actually managing vaccine distribution and allocations and the challenges and frustration that have come thus far. So it's kind of been an arc of services that we've experienced over the last year, and we're happy to be on the let's beat this thing back phase at this point.
And along this entire journey, there has been a variety of examples where, as we're sharing struggles, best practices, learning, our infectious disease clinicians spending time talking to each other. Jeff mentioned research, and of course, we did some of the same work. Our pharmacy teams working together. We attend each other's pharmacy and therapeutics committee meetings. So there's a lot of cross-pollination that goes on, and that really serves to strengthen our service to the community.
That's great. And I want to talk a little bit more about that beating back the virus phase, and particularly what you're doing together on vaccinations. So you mentioned before that you're partnering with Microsoft on this work. Can you tell us about that partnership and how it's supporting your vaccination strategy?
Well, that was a mid-January 2021. Representatives from Microsoft and Starbucks approaching the Eastside Health Network that Jeff mentioned with an offer to partner in the development and implementation of vaccine operations on the Redmond campus to help reduce the burden on our facilities created by on-site operations. I still remember right before Christmas, found out that we were going to get vaccine. I think it was the 22nd or 23rd. And my wife looks at me and she says, "You better not be here on Christmas. I expect if you've got vaccine, you're at the hospital making sure that people are getting the shots." And so our journey started in earnest on campus, which is a huge stress, taking facilities and areas of the hospital that had other uses and driving large volumes of patients through them. I know Jeff's hospital did the same thing. We toured each other's facilities.
Definitely, we had similar challenges of managing space and flow of the public into hospital facilities, which are not intended to serve those kind of volume of patients in such short order. Our support staff, our big gap was also technology. One of the things that Microsoft actually brought to the table was actually scheduling and data management software that they basically had a off the shelf, and they spent a lot of time and resources customizing it to serve this function and making it available. So that was a big piece of it. They also served as a large voice for us in locally and at the state level to get vaccine allocated to our mass vaccination site. Having the partnership of the two hospitals with a partner like Microsoft amplified the voices of all of the organizations and actually got us a seat at the table in terms of how decisions were being made. And that allowed us also to target certain underserved groups in the community. Our commitment and Microsoft's commitment throughout this was to make sure that there were no barriers to getting vaccinated. And so by working with the county, Evergreen actually has a call center, and we ramped up our call center and expanded capabilities, and then did outbound outreach in addition to inbound service for high risk communities so that technology wouldn't be a barrier. People could make a phone call and get a vaccine appointment, and we could do outbound calls based on community identified lists of high risk organizations and their members. And that's proven to be very successful.
That's great. And it certainly must have been helpful to have a technology partner like that with expertise in that area. So I'm also curious, but just, Microsoft is clearly not a healthcare organization. So like, how did this all come together? And do you have any stories that would bring it to life for our listeners?
Yeah, certainly. You know what was interesting, and I think Gordon would echo this, is I've been so impressed that Microsoft's not a healthcare provider, but I think their passion has mirrored our own in terms of providing this service. We recently celebrated 100,000th vaccination at the site in a little over 3 months, and I think they and their staff were as excited as our teams were with that accomplishment because they really saw a way to contribute to the public health efforts. But really, they look to us as the healthcare expertise. We brought, obviously, Gordon is a pharmacist. We provided access to physicians, pharmacists, nurses, and other clinical staff to ensure that we are providing a safe environment that's compliant, reporting data, all the requirements that go along with that, and providing the clinical expertise. We also have the relationships with many of these people as our patients. And so when all of this is done, patients will seek care from us for ongoing medical reasons. So we wanted to make sure that that was maintained. We also brought the call center, but they did a lot of the support staff functions and the wraparound services in addition to the technology support.
Now, this is a level of corporate partnership that I've never seen in my career. And my hair is pretty gray. You can't see it, but it's pretty gray. It's hanging on there. It is emotional to talk about. I will never forget this. In addition to Microsoft, we also had Starbucks that partnered with us. And, that company really brought human-centered design, workflow optimization, operational efficiency, which is, largely this partnership, as it was coalesced, inception to first immunization on February 2nd was literally 2 to 3 weeks. I mean, it's just astounding. And when they told me about this project and what their expected timeline was, I'm not often apoplectic. I can usually say something, but I didn't know what to say. By this time, I'd already been doing the hospital clinic for so long. It's kind of like, okay, somebody's got a great setup. Let's do it. You have to imagine this conference center turned a mass vaccination site in your mind's eye. It's hard to do on radio, but if you close your eyes, if you're listening to this, imagine you get off the freeway, you're approaching this site. At every street leading into the site, there's signs directing you to the mass vaccination site. Their signage was incredible. As you approach the campus, traffic guides, making sure you know exactly where to park at all levels and all entrances. Someone's there to assist and guide. It's literally impossible to get lost on the site. As you enter the building, you're greeted, you're directed to health screening stations, where after answering a few questions, you go onward to the vaccine provider's point of dispensing locations. Signs and guides available, language support, routing to queues if we're busy, but most of the time, just a nice, steady flow. We talk about it's a walk-in clinic with appointments, because literally the only time you stop walking is as you stand still for your vaccination and as you sit in observation. They're using QR codes to confirm the emails. People are using their phones, they're using paper. Once you get vaccinated, literally after your injection, you're getting your appointment on your phone for your next dose. And if you're not sure how to do the scheduling, there's somebody in the observation area available to help you. CDC record card, observation discharge time on a sticker. They're using ferry lines in observation. It is so orderly and orchestrated. It's a sight to behold. It's a sight that is pretty doggone amazing. As you're sitting in observation, there's a slideshow, the lights are dimmed, there's some music in the background. That's the stuff that Starbucks brought for us. A nurse is circulating in the room to check on you, to make sure that you are aware of your discharge time if you've got any questions. There's a medical base set up with EMS. We've got law enforcement presence if we needed it. There's an EMS vehicle parked out front if somebody needed care. The details, the extras, the orderliness has really been quite an experience.
It's really incredible what you can build when everyone's working together for the same goal and leveraging all the expertise and capabilities that they have. It's really incredible. So as you start thinking back on this process and how it all came together, what lessons learned can you share with other hospitals that are seeking to partner with each other and to partner with corporations to facilitate their vaccine distribution efforts?
Yeah, I think a lot of this is around building on the strengths of organizations and what you do well. I mean, certainly there's been deference to the healthcare systems for the healthcare decision making, even if it didn't necessarily work the best in a certain situation as far as a mass vac site. But you have to defer to the healthcare. I mean, this is first and foremost a healthcare service, even if it can certainly be delivered in a different way. So I think there is respect for the healthcare leaders and their decision making and keeping things safe for people. I think it's important to define roles and accountability. As we've gone through this, as working with non-healthcare people, we provided training on HIPAA training and compliance and infection control. Those are the kinds of things that we take for granted in our day-to-day lives that we have to make sure that others are aware of and respect and follow and ask questions if they don't understand. But I also think as you're looking at partners is to look non-traditionally. When this all started and Starbucks said we want to help, I think all of us said, what are they going to do? But they have tremendous experience in process flow modeling and queuing. We had lively conversations about whether somebody should sit or stand for their vaccination and what is the behavior of people in lines. These are things that organizations like Starbucks have studied extensively. We joked about the Starbucks playlist, where we're going to have access to the playlist for the music, but they spent 7 days a week. They brought our teams down to their modeling center in Seattle, where Starbucks is based, and modeled the flow with them to make sure that we could optimize capacity of the site and of the people resources that were going through there. So it was fascinating to see that at play. But as organizations that may not have the opportunity for a Microsoft or Starbucks in their community is looking what other people can bring. Microsoft had a conference center. That's what started all of this. They had the actual physical facility, and most communities have a facility that's appropriate. And from there, it just blossomed to what each organization could bring to the table.
Just to build on Jeff, it's being open to the possibilities presented by what may seem at first like unlikely partners with seemingly impossible aspirations and unattainable timelines. And yet, here we are today. I think the other partnership that was very important to our relationship was the Seeking Local Health Jurisdictions partnership. So very early on, the partnership with Public Health, Seattle-King County, I would say a real key to our success, because in collaboration with them, alignment of purpose, they were advocating for the vaccine supply, as Jeff mentioned early. They were really guiding us to making sure that we had access for all languages, for our underserved, for our BIPOC communities. Great population focus. We meet with them on a weekly basis to sort of review how things are going. They would present challenges, review target demographics that we needed to focus on. And we've hit those demographics. We've served those underserved. Our statistical review shows that. And even more than just statistics, to actually watch the community flow through the site, which is like watching a cross section of your community. We toured some of our board members through recently, and they were very touched watching folks come in, because it was every age, it was every walk of life, it was every ethnicity, it was every religion from our community utilizing the site to get this life-saving treatment. It was inspiring, it was humbling to be able to serve the community like this, seeing thousands each day getting their vaccine and getting all of us one step closer to a much needed return to normalcy. I want to take a vacation someday, but I do not want to take a vacation with a mask on and with everybody running around me with masks on. This is part of getting us back there.
Absolutely. So as we keep moving in that direction, what's next for Overlake and Evergreen in your vaccination efforts? And do you have plans to continue your partnership with Microsoft and Starbucks once the pandemic subsides?
Huge topic of discussion right now, right, Jeff?
Yeah, definitely. We're actually in that planning phase now. The mass vaccination site is still going. 12 to 15-year-olds just became newly eligible, so we're already serving them today. They became eligible officially, and we're serving them today. But it's really knowing that what are we going to do between now and when additional age groups, younger children, how are we going to serve them if possible? And then what happens if booster shots, booster doses are required? Are we going to do that through the mass vaccination site? The other piece that we're doing now is how can we partner on taking the show on the road a little bit to community sites? We've done a little bit of that. We've really focused our resources on the mass vac site. When we're doing 5,000 or 6,000 doses a day, that required the full-time attention of the organizations. And so we're now working with the county to get those remaining pockets of communities that are struggling to get to the vaccine sites or get vaccine in other ways. So we are looking at that, but it's really about how do we pivot more towards the traditional healthcare sector in the future? How do we establish this back in our clinics as a normal way of getting vaccine? But we anticipate that there will be a continued presence with Microsoft until probably for the remainder of this year. And they've indicated they're in this for the long term until the need is no longer there. They're also a big employer in this community. And so they have an interest in serving their employees long beyond these first 2 doses. So we're already starting those conversations.
And in both organizations, we're committed to waging this battle. I mean, this is what we do. The partnership really, really helps. I mean, it is pivotal, but as long as it takes to end the pandemic, we're going to be there. It's that next step. I mean, we're all watching with anticipation pharmaceutical developments. As a pharmacist, that's sort of a key thing I'm looking for. That's really going to shape the next phase. Watching the epidemiology of the disease, that's going to shape next responses. I've looked at this as plans developed on an Etch-a-Sketch, and we would get a plan developed and then something would change. And talk about learning or strengthening your ability to pivot and change your design, modify things, reshape things on the fly as necessary to respond to the next event. Holy smokes, we've had plenty of practice at that, that's for sure.
That is for sure. Well, Gordon, Jeff, thank you so much for joining me today and sharing your story. It really is inspiring what you've been able to do by working together and by working with Microsoft and Starbucks. And I only wish I could be there to see it in person. I look forward to hearing how this work continues to grow over the next few months. So to visit our growing repository of resources on COVID-19 vaccine distribution, you can visit us at www.aha.org/vaccine confidence. That's it for today, and thank you all for listening.